Today, we are diving into something that's so important, but honestly doesn't get talked about nearly enough. We're going to talk about the unspoken side of pregnancy, the real, raw, emotional side of things that goes way beyond the perfect baby bump photos.
This quote, it just hits the nail on the head, doesn't it? Because yeah, there's so much joy, but for so many of us, it's also a time of anxiety, of fear, maybe even a little bit of overwhelm. And if you've ever felt that, I want you to hear this loud and clear. You are so not alone.
So let's start with the biggest question that probably pops into your head. Are my feelings normal? Is it okay to feel this way? And the answer is a huge, resounding yes. Let's actually look at what some of these common experiences are. So take a look at this list. Does any of it feel familiar? Maybe it's that constant nagging anxiety, or feeling a little irritable or down. Or maybe you're wrestling with some pretty big fears about childbirth itself. It could be the stress of a high-risk pregnancy, or just feeling kind of lonely and unsupported through it all. And let's be real, juggling pregnancy with everything else life throws at you, it's a lot. If any of this is ringing a bell, then you're in the right place.
Sometimes just seeing these things written down with actual names can be a huge relief. Prenatal anxiety. That's not just you being a worrier. It's a real thing. Emotional adjustment difficulties. That perfectly describes that feeling of, who am I now? My body is changing. My whole life is changing. Giving it a name makes it real, and it validates every single thing you might be feeling.
Okay, so if you're going through any of this, what does getting support even mean? It can sound like this big, scary thing, right? Well, let's pull back the curtain and demystify what prenatal mental health care actually looks like. It's probably not what you think. At its heart, therapeutic support is really just this: a safe, completely confidential space for you. That's it. It's a place where you can manage all those racing thoughts, those deep-down fears, and all the emotional ups and downs with someone who is trained to help without any judgment at all. And the path to feeling better is actually pretty straightforward. First, you talk it out. You use proven tools to help manage your thoughts. Then you learn practical skills like simple breathing techniques to calm your body and mind in moments of stress. It's also about building a team, making sure your mental health support is on the same page as your doctors or midwives. And finally, you stay connected. It's not a one-and-done thing. It's about having those regular check-ins so you feel supported the whole way through.
All right, so how do you actually find the right person for you? Because let's be honest, not all therapists are created equal, especially when it comes to pregnancy. Knowing what to look for is absolutely key.
Here are 3 really big things to keep an eye out for. First, do they have perinatal expertise? That just means they specialize in pregnancy and postpartum. They get the unique challenges. It matters. Second, is it a safe, non-judgmental space? This one's non-negotiable. You have to feel like you can say anything. And finally, are they culturally sensitive? You need someone who respects your background, your beliefs, your story. Now, I know that even after hearing all this, you might still have some questions, some what-ifs floating around. That's totally normal. So let's do a quick little Q&A and tackle some of the most common concerns right now. Okay, this is a huge one. Do you have to wait for a doctor to officially diagnose you with something like prenatal anxiety before you're allowed to ask for help? Let me be crystal clear. No, absolutely not. If you're feeling overwhelmed, if things just feel hard, that is reason enough. Your feelings are valid, period. You don't need a label or a diagnosis to deserve support. Reaching out is all that matters. What about privacy? I mean, you're sharing some really personal stuff. Can you trust that what you say in therapy stays in therapy? Yes. 100% yes. Confidentiality is the bedrock of good therapy. Any reputable provider is bound by super strict ethical and legal standards to protect your privacy. Your story is safe. And what about your partner? This whole experience involves them too. Is it possible for them to come to sessions with you?
Oh, absolutely. And it can be such a game changer. Bringing your partner in can help them understand what you're really going through on a deeper level. It helps you get on the same page and strengthens you as a team, which is pretty great practice for what's to come, right?
I really want this to sink in. Asking for help isn't a sign of weakness. It's not a sign that you're failing. It is, without a doubt, a profound sign of strength. It shows you're taking care of yourself so you can be the best parent you can be. So I'll just leave you with this final thought. We always think of motherhood as starting when the baby arrives. But what if it starts sooner? What if your very first act of motherhood was deciding to take care of you? Just something to think about. Thanks for being here with me today.